Good Thursday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Director here at the Knox County Health Department. Charity Menifee will join me in just a few minutes to talk about the benchmarks. Our moment of gratitude today is dedicated to our team who is prepping for COVID-19 vaccine distribution. As you can imagine, there are a lot of moving parts and logistical pieces to work through when it comes to prepping for such a large project. I'm extremely proud of our team for rising to the challenge and using their expertise and training as we plan ahead for future distribution. As a reminder, we are not testing for COVID today because our staff is operating 2 flu vaccination clinics in our community as part of the Tennessee Department of Health's Fight Flu TN campaign. Both clinics are offering free flu vaccines to those 6 months and up. Check out our website to see the locations and times of today's clinics. The Knox County Board of Health announced last night that they will be holding a special called meeting on Friday at 5 p.m. via Zoom. The agenda for the meeting is posted online on the Board of Health's webpage. Per the agenda, the board plans to discuss the current COVID-19 situation, given the rise in cases, hospitalizations, and deaths. The board also plans to review regulations in other jurisdictions and states and determine what, if any, further action should be taken to help mitigate the spread of disease in our community. The public can watch the meeting live on community television, Knox County's YouTube channel, or the Knox County website. Before we move to the local situation, I want to show one graphic that we hope will help visually depict the risk of not following the 5 core actions. So there's the graphic. In this graphic, you see a small dinner gathering. Folks aren't wearing their masks because they're eating, but since they are not in the same household, they should be set up at least 6 feet away from each other. You can see the man identified as Tom is positive with COVID, but he doesn't know it because he doesn't have any symptoms. At this dinner party, he is potentially infecting the 6 people around him. They, in turn, could become infectious and spread the disease to the people in their circles, like a long-term care facility, or the upcoming basketball game, or the baby shower. It's a domino effect that ends with more cases in our community. And it's really easy to do that because this is not a situation where you want to wear a mask or try to spread out 6 feet. It only takes one infected person to spread COVID-19. This is a very contagious disease, and you often may not realize the connections around you and the implications of not following the 5 core actions. Please make a point to follow these core actions this holiday season to loosen the grip COVID-19 has on our community. I will now move to the local situation. We have 233 new confirmed cases since yesterday's report, giving us 16,388 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 910 probable cases. 14,888 of our cases are considered inactive, giving us 2,270 active cases. 540 individuals have been hospitalized at some point in their illness. 83 Knox County residents are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 140. These numbers are grim and not going in the right direction. And it's up to us as a community to change that. And so I want you to take a moment and look at those numbers. We've hit the highest numbers we've had in Knox County this whole time. And we as a community can change that, but we have to be willing to do it. Everybody out there has to be willing to do their part. And all of us here have to be willing to do our parts. But anyway, that's my editorializing for the day. I'm going to turn it over to Charity to go over the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. All of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/benchmarks. case-count. And here's Charity.
All right, moving to our first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we hit a new record high in case volume. There were 6 red flags observed over 2 3-day trends. We saw an average of 215 new cases per day over the past 7 days and 185 new cases per day over the last 14 days. Because of these factors, we are representing this benchmark as red. Seeing such a high difference between the last 7 days and the 7 days before that is very concerning, and that's really why we're pushing these messages to try to get the point across of the situation that we're in. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test resulting reporting turnaround time. For this benchmark, we're utilizing 2 bar graphs, one that shows a sample of the test conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, we did have 5 red flags and 1 yellow flag, and there were consecutive days of flags during this time period. However, the total number of tests conducted has increased over recent weeks, with more than 10,000 tests conducted in Knox County between November 8th and 14th. And that's a good thing, and we want to continue to encourage that. However, lab turnaround time has increased since the beginning of September, and it is now between 4 and 5 days. And because of those factors, specifically looking at that lab turnaround time, which is very concerning, we are representing this benchmark as red. Our third benchmark, sustained or increased public health capability. As we mentioned on Tuesday, this benchmark has undergone some change due to the growing volume of cases. While the Tennessee Department of Health has been helping with contact monitoring for a while now, they are now assisting with case investigation in the contact tracing piece. This type of partnership between local health departments and TDH is occurring across the state in order to try to meet the growing demand. The goals remain to initiate investigations for all new cases within 24 hours of notification and initiate close contact investigations within 48 hours of notification. However, the traffic light color will not only be based on metrics identified in this benchmark, but also KCHD's continuous assessment of our internal ability. Based on the recent process changes, a percentage for response time isn't available this week. However, our internal assessment of our current ability has us classifying this benchmark as yellow. We want to take a minute to talk about community-wide transmission that we're seeing and the impact on contact tracing. As we previously showed in the graphic that Dr. Buchanan went over, there are many opportunities for exposure if you aren't following the 5 core actions. A small gathering can lead you to potentially carry the virus and spread it to your workplace, your child's sporting event, somewhere else. This makes it much harder to pinpoint a specific place because of the exposure. Essentially, the exposure can be anywhere with the amount of community-wide spread that we have going on at this point. There's many potential exposures. So this is why it is so important to behave as if anyone you come in contact with could have given you COVID or vice versa. That's where the 5 core actions come into play, and it's why it's so important to follow them at all times. Now moving on to our 4th benchmark. Healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS, and it may reflect Knox County, the East Region, or patients from other jurisdictions. During this time period, there were 9 consecutive red flags detected for the number of inpatients with COVID-19. Additionally, there were 11 red flags detected for COVID patients in the ICU, and 2 red flags and 1 yellow flag on consecutive days for the number of COVID patients on ventilators. After speaking with our hospital partners, they have recommended that this benchmark be represented as a worsening yellow, which you can see is shown on our webpage as a yellow with an upwards arrow indicating rising numbers. And just to point out, I think we're at 341, I believe, was the most recent and by far highest hospitalizations in the region. That's a lot of people. We report the daily Knox County numbers, which are also rising and concerning. But when you think about the entire volume of COVID positive patients in the hospital in the region, it's challenging for the hospitals. As always, the hospital systems continue to meet routinely to work together to ensure that no system is impacted disproportionately and plan the response together to best serve the community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. In our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of deaths. We have seen 10 deaths related to COVID-19 over the past 7 days and 26 deaths in the last 14 days. The information available leads us to represent this benchmark as red. And finally, under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 39 new cases per 100,000, and our 7-day trend line shows 45 new cases per 100,000. And again, that number is increasing. We need it to be decreasing. The second chart shows the percent positive for COVID-19. The data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 13.49%. When you look at the added metrics that the Board of Health have put into place with those two metrics, we are above the escalation threshold, and that is concerning. We are well above that for both of those metrics. And so, again, really want to reiterate the use of the 5 core actions all the time, even when you think it's safe. You don't want to be the one spreading it if you have it and you don't know it. And you don't want to get it in those situations and spread it to others as well. So with that, we'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. All right, from Cole with WBIR, do you have dates of death for the 2 reported today?
I don't have them, Cole. Those will be reflected on the graph next week.
From Jeff with WATE, we've seen deaths and new case numbers ease back from the new records at the start of the week. Does that indicate anything about a change in the virus situation or anything about those spikes from a few days ago?
I really don't think so. I think we try not to look at things one day at a time, and we look at trends, and the trend is still overwhelmingly moving in the wrong direction, and that's what we're seeing. So we are waiting to see what's going to come over the next few days, especially when we talk about there's lab delays as well. That roll into that. So again, let's look at what the trend looks like over time, but overall, we're concerned about the trajectory that we're seeing.
From Isabel with the Sentinel, what are the specific regulations from other areas that the Board of Health members will review on Friday?
Having just learned about this yesterday, we're looking, searching literature from the CDC and the World Health Organization, Johns Hopkins University, to look what's been done in other communities that has helped improve case counts and bring those case counts and resulting hospitalizations and deaths down. So I don't have any specifics. I know there's some publications from the morbidity and mortality weekly report that the CDC puts out, where there's some state examples where putting things in place did make a difference. So we're looking for those examples right now so that we can share them with the board.
From Cole with WBIR, are you concerned at all about mixed messages being sent when this department, the governor, and the White House task force are all discouraging large gatherings, and UT is holding an in-person indoor graduation with hundreds of attendees?
We certainly have concerns about large gatherings, and we know that UT has planned carefully for these events, and events at the university are not under the control of our local regulations. And we also really hope that folks who attending will take individual responsibility to protect themselves and their families, not go if they're sick, not go if they've been a contact to a case. So we're hopeful that we won't see a rise in cases from that, but we'll have to watch and see.
From Isabel with the Sentinel, when and where can we get a copy of the proposals for future Board of Health action?
That would be after the board meets.
From Abby with WBLT, and just real quick, Isabel, to your question, similar to when they meet every other week, decisions are then posted to their webpage. So you can check the website afterwards.
Sorry.
And Abby with WVLT, we're wanting to know more about the vaccine distribution plan, where it will be distributed first, and what security measures are in place to make sure each vaccine is given out to the people they are intended for.
We're going back and forth on who's going to answer it because our director of nursing, Dina Mashburn, is the primary point of contact that can answer these questions better than us. She's been in the weeds with the planning. But can you read the
I'm not sure what happened, if anything happened on your all's end, but somehow our Zoom just cut out unexpectedly. So I think we're back up. If there's any issues though, let us know if you can't hear us or see us. Everything looks to be okay on our end now. However, I will say all of the questions disappeared from the chat. So if we hadn't gotten to your question yet, you'll have to go ahead and resubmit those. We apologize. Not really sure what happened there.
So anyway, I was saying our plans are always in place to work with our partners to also secure our vaccine distribution plans and our vaccine distribution locations and make sure that they're safe for the folks that are working and coming to those. And so I'm sure more information will come out. They are very, very frequently meeting together and talking through these. So we'll get more information out as soon as we can.
Okay. And once again, folks, you'll have to go and resubmit your questions. We apologize for that. But it wiped our chat feature clean. From Claire with WUOT, will the Board of Health still meet on Wednesday, November 25th?
At this time, I believe that stands. That will be the board's decision.
Also from Claire with WUOT, why isn't the death rate among positive cases decreasing? We know why the countywide death count increases with new cases, but with all that scientists have learned about the virus this year, why isn't the death rate among positive cases going down?
Well, because treating COVID is complicated. And as we learn more about it, more people do survive, but people still do die from COVID. And we've seen some increase in cases among older
All right. I think we're back up again. We apologize, everybody. We're not quite sure. We have some folks taking a look at what could be happening.
I'll go ahead and finish answering the question. Now I can't remember what it was because I got distracted.
So
The guidance
the
for
messages.
contact tracers.
Contact tracers. So folks who, after they're positive, we don't know how long their immunity lasts. So we are still advising them to follow the 5 core actions after they recover. Charity wants to say more
Sorry.
about that.
Part of that is correct, though. The 90-day piece, we do right now, the current guidance is we don't count a case as a new case if it happened within a 90-day time period, but we are absolutely not recommending that they don't wear masks. And so we'll address that with our team, but there's also contact tracers all across the state. So we'll try to make sure that gets made clear to everyone that we have to, that guidance corrected. And we don't have any questions.
Once again, we'll need you to resubmit your questions. We apologize, everybody. From Cole with WBIR, Kentucky announced a bunch of new virus restrictions yesterday, including closing indoor dining in schools and limiting gatherings to 8 people maximum. Given the case count and positivity rate here, should we do the same? Would it help reduce spread?
That'll be something that the Board of Health will discuss tomorrow, and we'll look at all of the different options. Like we said, they're looking at other areas, and they will all bring their own opinions and data to the discussion and their expertise as well. So more to come on that, but we do want to encourage, the behind that is the 5 core actions and ways to help make sure people are following those. And we do encourage people to continue to do that.
From Megan with WBLT, what options are available for anyone who would like to get tested while KCHD is not offering it during flu shot clinics?
On our website, there's an interactive map that has testing locations all across the county, and you can also contact your provider and ask them as well. But we are by far not the only testing show in town, and do encourage people to look at those other options as well. Oh, yeah, and the East and the regional health offices, the other surrounding counties may also be offering testing. You can look at those as well.
From Brian Hornback, will private public group size limitations like Davidson County impose today a likely discussion by the board tomorrow night?
Again, they're all going to bring their own, they're doing their research and going to bring all of their different recommendations and ideas to the table. And so I can't speak to what they're going to say and discuss, but as Dr. Buchanan said, we're looking at what other jurisdictions are doing, and she will have that information from our perspective for tomorrow night.
From Cole with WBIR, we've gotten several viewers who say they've seen more people than ever wearing masks, and yet cases are at an all-time high. One writes, if masks work, then how come this current wave is bigger with more mask use? Can you help us answer this question?
Yeah, I think one of the things is, it's not just the mask, it's also the staying away from each other. We've talked about that's complementary. Those are complementary strategies. But the other thing I'll say is, and I agree, I see masks most of the places, and I think that's great. And that's why we're not harping on the wearing the mask when you go to the grocery store or those types of things, because people are doing that. What we are seeing and what we're hearing, and that's not just here, across the state, across the country, you can look at the data, and public health officials are talking about this. It's those public or private gatherings of groups of people, and that can be at the workplace, it can be at homes, it can be at sporting events, all of those things where it's small groups of people, typically when they're not wearing their mask, where they think they're safe, where they think, oh, those people haven't had it, or did somebody, even just like we have talked about in the past, they might have been tested negative that day, but the next day they're going to be positive, and they have a dinner party the day after they were negative, and then they show up positive there. So it's those type of things where, and we've been talking about this for months, where people are letting their guard down, that are really what's helping to push the spread of this virus. All of those different settings where those small groups of people are gathering is the challenge.
From Jeff with WATE, with contact tracing, I heard that you can't give a percentage, but can you give us any sense of or any numbers about how the increased demand on tracers is affecting their ability to make and maintain contact? Even anecdotally, how far are we from getting back to green or going to red?
I think it's going to be a little while before we're back to green, just with the sheer volume of cases that we're seeing. It's challenging. It's an uphill climb, and it's really up to the community to be able to make that difference there. We're initiating the investigations. We're reaching out to folks. The state's doing that as well for us at this point. But we still also have a portion of people who won't cooperate, and we need that to go up as well. So all of those things combined, growing numbers, which have growing numbers of contacts, plus lack of cooperation makes our team's job very challenging. They're very frustrated. They see the numbers going up, and that impacts them. They don't want to see that. And so again, it's up to the community to make a difference here, and we're asking you to please do that. Please follow these 5 core actions all the time so that we can see these numbers start going back down.
From Abby with WVLT, how long are people waiting for their COVID test results?
The average in the community at this point is 4 to 5 days, and that's an average. So there's a range there. Some people are getting them back on a shorter time frame, and then some it might be taking 7 days or more for those tests to come back. So again, I think we talked about this Tuesday or maybe last week, is if you have been exposed, absolutely stay home. You should be quarantining anyway. But if you've become sick and you think that you might have COVID, we're asking you to please go ahead and isolate and stop exposing other people to this potential virus while you're waiting on your test results.
From Cole with WBIR, if this pandemic is a marathon, what mile are we on? Have we started moving backward given the recent spike in cases?
We are definitely not heading in the right direction. We might be going backwards. Dr. Buchanan says that this is an ultra marathon. We have realized it's not just a regular marathon. At this point in time, we're still on the upward trend there. I still don't think at this point we've headed back down. We thought maybe we were heading in the right direction for a while, and it has not played out that way. So, I can't give you a number. I don't even know how far an ultra marathon is, but I know we're tired and wanting it to be finished.
All right. And I think there's about 5 more questions left in here, and we'll answer these. And then unfortunately, we won't be able to take any more just because we have a couple minutes left. So let's see. So it's the last one that's in there is from WVLT. That'll be the last one we'll be able to answer today. So the next question we have is from Claire with WUOT. She'd like you to please re-answer why the death rate among positive cases is going up, because it cut out mid-answer.
You want to? I'll let Dr. B, since you answered the first one.
May not say exactly the same way this time. Treating any medical disease is complicated, and unfortunately people still die. Even though we learn more about how to treat the disease, they still die from complications or of the disease, just like people die from flu. We've also seen an uptick in cases in our elderly population, and we know that folks who are older tend to have more complications and are more at risk for dying of COVID. So unfortunately, all of those things combined, the complexity of treating COVID and some increase in cases in our older population, combined to keep our deaths higher than we'd like to see them.
From Cole with WBIR, with the spike in cases and the dire words from the White House task force, do you think the governor is doing enough to stop the spread of COVID-19, and is our community doing enough?
Well, the governor is listening to his advisors and making his decisions based on the information that he has available to him. What we can see now is that people in our community, I think, are getting they're just fatigued and letting their guard down more often. So we're seeing more cases. I think we have to look at the data to see if anything else would help besides encouraging everyone to follow the 5 core actions. What I just want everybody to think about is being so diligent about the 5 core actions that you just make all your friends crazy and your family crazy. And you're just really doing that all the time. And if all of us do that and do it even when we're at the baby shower, having, and avoiding lunch meetings, one of the things we've talked about internally is what are some of those little things you can do to reduce risk? Don't ride to a meeting with your coworker in the car. Drive separately. I know that's not ideal for the environment, but drive separately, because you're definitely less than 6 feet away. And even if you wear a mask, that drive is more than 15 minutes. If either one of you becomes a case, that's a contact. Think about when you go out to dinner, if you want to have a lunch meeting for work, brown bag it and do it somewhere where you can spread out 6 feet apart. Be creative on how you can accomplish these things and reduce your risk. Think about your own personal risk and the risk you're putting other people at, and make choices based on that. The 5 core actions aren't hard. If we'd all follow those, we could reduce cases.
From Cole with WBIR, given the recent surge in cases, has KCHD had any conversations with UT about the upcoming basketball season or remaining football games?
UT is watching the data just like we are, and making decisions internally on what they can do. And As far as sports go, they're following the SEC guidance.
Also from Cole with WBIR, you mentioned lack of cooperation with contact tracing. What rough percentage of people are not cooperating?
We don't have that number. We're not tracking it that way. So we don't have an exact number, but it's a daily occurrence for our case investigators to have to talk to somebody who is not willing to share the information we're asking for.
And the last question we have today is from Abby with WBLT. Are we seeing people who are positive and asymptomatic passing COVID-19 to more people on average?
I think if you look at the national data, it's probably stayed about the same. It's been right around 20.
I think it's 20 to 30%.
20 to 30%
We'll
of it.
look at it.
Yeah, we can look at that, but it's stayed pretty steady. It hasn't really increased. It stayed pretty steady over time based on the national and data.
All right, and that's all the questions today. Thank you all for your time. And once again, we apologize for some of those technical difficulties. We're going to try to get to the bottom of that to make sure that doesn't happen again in the future. So have a safe and good weekend, everybody.